This year, for the first time ever, global attention is focused on non-communicable diseases. In September, the United Nations will spend 2 days debating what can be done to improve prevention and control of NCDs.
This will be only the second United Nations conference on global health. This is going to be a very important meeting to address non-communicable diseases.
The world must act now to control the growing epidemic of non-communicable diseases, as more and more people are affected at an ever younger age.
What is sad is that these chronic diseases kill many young people who will be the next generation leaders, who will be a productive generation, and therefore we must do more to prevent these chronic diseases.
Four risk factors: tobacco use, poor diet, physical inactivity, and harmful use of alcohol contribute to more than 36 million deaths each year. Of these, 9 million die before they reach the age of 60. Millions more suffer with increased and prolonged levels of disease. But these diseases are about more than individual health. They also pose enormous economic and development challenges, damage productivity, and drive people into poverty. As catastrophic costs hit home, healthcare costs for people and the rising cost to healthcare systems is already having a devastating impact. And at a global level, progress on poverty reduction and towards meeting the Millennium Development Goals will be threatened. This is a global epidemic that touches everyone, everywhere. Men and women, young and old, rich and poor, all are at risk. But it's in low and middle income countries where people are most affected because the protections against the risks and consequences of NCDs are lower there.
9 in 10 people who die from non-communicable disease before the age of 60 come from low and middle income countries. And this has very serious implications.
But it's not all bad news. Many of the risks and consequences of non-communicable diseases are preventable. Solutions do exist. Things can and are being done.
There are preventable and cost-effective solutions that are affordable to all countries. Measures to reduce tobacco use and the harmful use of alcohol, reducing salt content in the foods people eat to reduce high blood pressure, and the treatment of cardiovascular diseases and diabetes.
To be successful, the plan will need commitment at all levels of society and from all sectors. First, though, it will need leadership from government.
The health sector can gather evidence of the harm, including the cost to society. But the health sector cannot do everything. It is up to other sectors to introduce the policies and the legislations and confer protection.
The need for reducing tobacco, improving the diet, trade policies, education sector, a range of other sectors were addressed, as well as health. And this gives an idea of why it needs to go to heads of state, because most of the risks for this epidemic of killer NCDs lie outside of the health sector.
The UN Summit in September provides a unique opportunity to build international commitment and put NCDs high on the development agenda. At stake is more than the hard-won gains made in developing countries and poverty reduction initiatives like the Millennium Development Goals. At stake are the lives of millions of people around the world who will otherwise suffer needlessly and die prematurely for lack of concerted, coordinated action.